Welcome, everyone. Welcome to our town hall meeting. We're at the Mars Auditorium next to Toronto General and broadcasting to the Western, 3 TRI sites in Princess Margaret. My name is Michael Baker, and I may be the longest-serving doctor at UHN, having started my career at Toronto Western Hospital in 1972. It's only fitting, perhaps, that I'm here to introduce one of the most recent doctors appointed to UHN, a man who started in January 2015. A characteristic of my years here has been change, that conundrum that change is the only constant. I've been witness to the creation of UHN and to our arrival on the world stage as the leading hospital and health science center in Canada and amongst the best in the world. I have admired my previous 5 CEOs. CEOs come and go, but doctors are here, yeah. I have admired my previous 5 CEOs for their inspiring visions and their introduction of innovative strategies and structures to create an environment where all of us have been able to flourish. But we all recognize that medicine, science, and societal values continue to evolve. In my 1972 laboratory, I used a typewriter, a slide rule, and I had a dial telephone with a wire attached to the wall. My Nikon camera used film. To build on our legacy of excellence and leadership, we will continue to reshape our vision, our strategies, and the structures that support them. So we are fortunate to have attracted a president and CEO who has helped lead some of the world's leading hospitals, who is a healthcare professional, an educator, and an innovator in his own right, who will share with us today his vision, strategy, and structures to ensure we continue to lead healthcare in Canada and the world. Please welcome Dr. Peter Pisters.
Thanks, Michael. Well, Michael, thank you very much. I want to begin by thanking all of you. I knew there could be a few people here, but I didn't quite expect to have this size of a group. And I know that we're in the process of simulcasting to other locations. And I hope that this really enables us to come together and to talk about a real opportunity that I see for organizational renewal. And that's how I want to really frame this conversation and think about the things that we do together, how we're going to really advance the organization towards the shared efforts that we have around education, superb patient care, and research. So, as I said a moment ago, I really want us to think about this from the perspective of renewal. And this allows us to really think about how we move the organization forward together, how we will advance the grand ambitions that all of us have, and how we will organize ourselves, how we will optimize the way that we work together to be able to achieve on many of the aspirations that I've heard from all of you. We want to be able to position ourselves for strategic planning, for execution of that strategy in the near-term future. We need to be resilient. We need to be adaptable. Our environment is changing constantly, and we've got to be the most nimble, most adaptable organization in order to position ourselves for future growth. It's certainly my hope, and I'm certain yours, that we position UHN to be even bigger, greater, grander, more successful, that we impact more patients, we save more lives, we have more discovery, we have more innovation. What I'd like to cover today is to focus on these areas that I think will help us to come together around a shared understanding of how we will work together, beginning with a careful look and redesign of the top of the organization. I'd like to introduce a new executive team that will come together around the key pillars of our mission. We want to talk about some of the key shifts in how we operate will work. We want to try to understand the rationale behind that and how that will help us to optimize our ability to execute and to advance the organization over time. I'll finish with a summary of some key organizational shifts that will have some implications for many of the people in the room and those who are watching. And then at the end, we'll pull it all together so that we can summarize and get a big picture view of what we're trying to accomplish together. So let's begin with the objectives and the process. I think one of the things that I wanted to do at the very outset was to ask, what are the key areas that we really need to focus on? And as I'll show you in a moment, we can distill that down into 7 areas that I think we would all agree we need to have organizational excellence in. We need to excel in. We need to create alignment of authority and accountability so that we can operate effectively and efficiently, and so that we can improve on the outcomes. The great outcomes that we have, the outcomes that we desire, the experience that we want to provide for the patients that we care for, the experience that we want to provide for the students that are in our facilities, and for the research that we conduct throughout the organization. We need to optimize how we work. I've said in many forums, many times already, that we need to be safer, we need to be smarter, and we need to be simpler. I want to make a clear message to all of you around those issues in the context of today's comments, because we have a clear need to look closely at our desks and to ask ourselves, what things here do we no longer need to do? What will enable us to embrace some of the new ambitions we have around quality and safety, our future efforts around the patient experience, and how can we really focus our attention on what is important? We want to optimize our leadership structure for the complexity of the organization. As I've inherited the organization from my predecessors, it's grown largely organically. It's very functional right now. What we need to do together is to optimize how we work to prepare for the future. And that will involve us rethinking the design that we have, the way in which we work together, and optimizing those things to enable us to work safer, smarter, and simpler. I want us to take back to the teams that are represented here in the room my sincere desire to simplify your work. Think about who needs to be at the meetings. Make sure those meetings are important. Make sure you look at the array of reports that you're generating or that are coming into your inbox and ask the question, are these really necessary? Who's using these? Is this still needed today? So that we think carefully about the work we do, and together we learn to work smarter. We use the principles of a learning health organization to really adapt ourselves and to work effectively and efficiently together. Now I want to talk a little bit about the process. How did we go about this? How did I personally think this through? Well, as everybody knows, when I first came here, it was really all about UHN. I wanted to listen, I wanted to ask questions, and I wanted to learn. I wanted that process to be deep, to be done in a way that was iterative, that was done in a way that was immersive, that allowed me to learn from you what your shared aspirations were. That enabled me to collect, to collate, to synthesize, and to grasp shared aspirations, to try to distill from that an understanding of purpose. Why are we here as an organization? What are we here to accomplish? I had great input from human resources and from external stakeholders who graciously volunteered their time and expertise to help us think about this. And we had discussions and meetings with external stakeholders, with hospital leaders from around North America, with the University of Toronto, a very important collaborator that we have here, our primary university affiliation, with companies, small, medium, and large, that do business with UHN and see the complexity of our organization as well as the incredible opportunity that we provide for relationships with them. And of course, with our board of trustees. As I connected with colleagues across North America, this enabled me to talk to other peer organizations, organizations that we often compare ourselves to, or that we have programs, groups, and subunits that benchmark against these caliber organizations. We want to be able to learn from them, to extract golden nuggets, ideas, concepts, principles, and to bring those to UHN, integrate them into our fabric, our culture, and optimize them for our future. Now, as I thought at the end of each week on what did I learn about UHN, and I collected my notes and I weaved them into themes, and this is what I shared with all of you at the AGM in June. And when we think about the core components of our mission, education, patient care, and research, the constant themes that emerged from a series of those conversations, distilled over time, is really summarized here, where we saw incredible collaboration. We saw amazing innovation, where innovation lives inside UHN through every program, through every hospital, through all 8 sites, where we saw a focus on excellence. We're so proud of what we do and what we accomplish, what we achieve for society. And when we see that enabled through the centers of excellence, through world-leading programs, and through our ability to lead medicine in both senses of the word, we really understand what really makes up UHN. What are the key elements that define us as an organization? Another thing that I've learned along the way is that this is not possible without the amazing administrative support that we have around us. We have unbelievable professionals around us in finance, in human resources, and in IT who provide the kinds of infrastructure and support that enable us to carry out the great work that we do. It's through this teamwork that brings together these components of our mission that is underpinned by these outstanding examples of administrative excellence that allow us to achieve everything that we aspire to collectively. So let's talk a little bit about our organizational design, our renewal process, and how we will enable that. One of the first questions that I asked when I arrived here was an ideological one. What is our purpose? And I've asked that question many times in many forums around the organization so that I can get an understanding of what we believe at the most ideological sense is our underlying purpose. And as I've distilled the words and the concepts, the notions and the ideas from all of you, we can distill it really down into a small collection of concepts that we exist to fulfill a moral obligation to serve patients. And everything that we do, everything, patient care, research, education, everything that we do is for them. It's to improve their lives. It's to find cures for incurable diseases. It's to discover new techniques, new approaches, innovation, and enable us to improve the quality of life, extend the length of life, and make massive societal contributions. That's what people are counting on us for. When we frame that around the Institute of Medicine aims for quality in terms of patient care, we see our shared goals to provide care that is patient-centered, that is effective, that is safe, that is equitable, timely, and efficient. Now, as I thought this through, one clear underlying principle is the following, that in order for us to fulfill this purpose, which I have distilled from so many conversations with all of you, from a listening tour that included multiple stops and many groups, we need excellence in these areas. We need excellence in our foundational support systems. We must have outstanding patient care. And we must deliver on our societal impact, the areas that people are counting on us. When we look at that more closely, what we're really talking about are business and finance, the talent that we have in the organization. After all, UHN is not a collection of buildings. It's all of us, the people. It's us working together. It's the human resources that enable us to work together. It's that fabric that creates what an institution really is. We need outstanding patient care. We need to sharpen our focus in clinical operations in an environment where resources are constrained and where we have to really learn to work more efficiently, more effectively year after year. We want to really we We have a commitment to patients to provide safe patient care, and that really underpins our entire clinical enterprise. All of us are here for another reason. Many of us drive long distances to come to work at UHN, and we do so because we're part of something bigger. We want to be part of an organization that creates amazing societal impact, that's having impact around the globe. And that's through the collective efforts that we have to harness the talent, to create innovation, to move us forward in technology, to advance research, and to facilitate education of the next generation of health professionals, the people who will be caring for us and who will be caring for our children. Now, when we look at this, what we see are these 7 areas that are created out of a single purpose, that really are carved out of these 3 domains where we must have excellence. And what we will do is to take these 7 areas and assign really one executive to each of these areas. Each of these areas are key to our success. We cannot succeed without our collective efforts to focus, to limit what we do, and to really work together. To do that, what we will do is to assign one executive vice president who has authority and accountability in each one of these 7 areas. And that will create a new executive team that will have a sharpened focus in the 7 areas that we have been talking about. So if we look at that, then this is the framework for the executive team in the organization, where we will assign one executive vice president to each one of these key roles with a shared understanding that we must have excellence, we must have efficiencies, we must be able to work together to sharpen our focus in these areas. What I'd like to do now is to walk through each one of these positions so that we can understand the makeup of the team, how we have realigned some portfolios in order to optimize over time, and how this will come together to enable us to work more effectively together. So let's really walk through the key members of the new executive team, starting with business and financial affairs. Justine is going to move into an elevated role with a wider portfolio. And what we have done for each one of these slides is to present the components of the portfolio in alphabetical order and the new areas of responsibility denoted by a triangle. So you can see the areas that have been really positioned under Justine that fall under the broad umbrella of business and finance. So we've added compliance, a point that I'll come back to later on in my comments, an area that we clearly need more focus. We've also grouped international, Altum Health, and other support services like printing and room bookings, other things that logically fall underneath the umbrella of business services. I'm confident, as I know you are, that Justine will be able to do a fantastic job in this role. She's done such an outstanding job as an interim president for all of you. I'm really looking forward to working with Justine in this capacity. Emma is going to lead our efforts in human resources. We heard at the AGM so graphically the impact of Emma over the course of many years in the organization, coming from outside UHN, from another industry, coming into an organization that has been described to me as one that needed healing, implementing great programs. When we see the commitment that she has, when we see the interface that she has with employees at all levels of the organization, we see respect and civility. We see Ask Emma. All of us turn to Emma for counsel. She's going to do a fantastic job in this role. I'd like to talk about these 2 roles together because this new role of EVP of Clinical Operations and an expanded role for Clinical Programs Quality and Safety, these will be 2 executives who will be teamed up. They will work together. And together, those 2 executives will oversee the entire clinical enterprise. $1.5 billion, all the patients, that we care for, all the outcomes that we're accountable to, the budget will flow through those two executives. We can't operate the organization without that kind of oversight, and we can't position ourselves to grow over time without streamlined focus on clinical operations. So the clinical operations position, which will be a new role in the organization, will facilitate all clinical operations reporting to one executive. All operations. So we're talking about emergency rooms, operating rooms, clinics. We're talking about an efficient operation and accountability aligned with one executive who has oversight over the entire system. We're talking about putting underneath that executive's specific clinical programs that have enterprise-wide impact. So we're talking about JDMI, for example, pharmacy, and the lab medicine program that are present in all our sites and provide needed support. We realize that we've got qualified internal candidates for that position, outstanding people that have made incredible contributions as hospital executives and leaders in their own sites. We also recognize that this will be a very important position. This will be a position attractive to other external candidates, in that we may benefit from bringing somebody who has an external lens and brings a different frame of reference to looking at clinical operations. Now, I will serve in an interim capacity in that role. If you think about it, that's what I do already. So I have 8 months of experience, and I will bring that to bear. But seriously, what this enables us to do is to sharpen our focus on operations. We'll create a different type of team now, a high-level operations team that will bring together the EVP of Clinical Operations, the EVP of Clinical Programs, the site leaders, key support services, and that group will have very, very operationally focused conversations. We will talk about the budget, the resource allocation. We will devote much more time to budget and operational issues than the executive team can afford to spend now. This will help us, I think, to create better allocation of resources and to be able to operate the organization more efficiently. So as this search is underway, I will serve in this capacity, and I will attend the SVP meetings that presently occur, where we have the 4 hospital SVPs coming together at a regular weekly meeting. That will enable me to immerse myself for this period of time, again, in the work that I already do, but with a sharpened focus working with that team while this search process is underway. Charlie will move into this role as EVP of Clinical Programs. If there's one thing that I've learned over the course of the time that I've been here is how much respect all of you have for Charlie. And how he has really elevated the VPMA position in the organization. Everyone sees him as somebody who understands the organization, who understands the concept of fairness, who sees both sides of issues. And I think that this creates an opportunity to pair Charlie up with the new executive that we will bring into that role. Underneath Charlie will be the clinical programs that we have presently that are largely but not exclusively hospital-based, the department chiefs that we have, and the rest of his existing portfolio, including medical affairs and the quality parts of our operation. I'll come back to the quality and safety issues later. So the way I would position this, as I've diagrammed it here, these two executives will be a team. They will come together to help us to deliver safe, effective, efficient, timely, equitable care. And we will know who the go-to people are for the issues related to this. I'd like to talk now about important aspects of our future as we think about technology and innovation. And when we're thinking about technology and innovation, we want to think in a broader sphere. We want to think bigger than just IT. We want to think about the future of bioinformatics, the Internet of Things, where all devices will be wired up inside and outside the hospital, where we will move progressively into cloud computing, where we will move into a much more rigorously defined interface with mobile devices and tablets, where our patients will be part of that experience, and where we will be looking at how the health sector interfaces with other sectors of the economy, where we have the possibility where we'll see convergence of the retail sector, healthcare sector, and telecommunications, just as an example. And we will need to think completely differently about areas like bioinformatics and our ability to really interface with patients who are wearing wearable devices or who are plugging themselves in every night and downloading information to us about their health status. We're going to move David Jaffrey into this role, and this will enable us to really build upon the great collaborations that David has built already throughout the organization, his insight, his relationships with industry, his connections with the radiation medicine program, JDMI, and other stakeholders, the great work he's done in cancer informatics. This creates an opportunity for David to team up with Lydia to build the great work that we've done already in SIMS, to extend the external partnerships that the SIMS team has helped us to build, and to bring together underneath that biomedical engineering and medical physics. We want to do this in a way that recognizes that innovation occurs everywhere in UHN. Innovation is inside every program. Innovation is inside every operating unit. But we want to have innovation facilitated for us. And we can do that with David, Lydia working together, and with our shared efforts to really grow the innovation that's inherent throughout the organization. I'd like to talk about science and research. As all of you know, Chris is stepping down from his role as VP of Research, but we're going to position him as the EVP of Research and Science as we build this new executive team, because it's my commitment to the research community to really sharpen the focus that we have on research. We have a group of young investigators that we need to foster. We have a different climate for grants than existed 10 years ago or 20 years ago. We have a need to nurture that group. We've got a need to think about different business models for research. We cannot be reliant on government grants as the exclusive source of support for research. We cannot be reliant on foundations to be the sole secondary source or the primary source as government funding continues to decline. We need alternate strategies for thinking about business models, different ways of thinking about our asset base, different ways of negotiating with pharmaceutical companies, with other partners that we have who can bring capital to the table and enable us to engage in completely different relationships that have a different risk-reward profile. In order to do that, we've got to have issues of science and research brought to the executive table. We've got to have deep conversations around those issues and enable us to move the organization forward so that science and research becomes a main focus of our executive discussions and our ability to move science and research forward. Many people are counting on us to do this. As everybody knows, we will be initiating an international search for Chris's successor. But in the time between now and when that individual arrives, we want Chris to be part of these conversations. We will be engaging in some deep discussions around many of the scientific issues that are affecting the Institute leaders. And this will help us to lay the table for the next person that will help us to advance research in the same way that Chris has over the time that he's been in this position. Education is so important to what we do. We have close to 6,000 trainees inside our organization. They do an incredible amount of clinical work. They're here for an educational experience. We're engaging in discussions with the Michener Institute about integrating a diploma granting organization into our organization, to changing the model for education of a whole group of health professionals, and creating ourselves as a supplier of a critical element of the workforce as we move into the worlds of genomic medicine and a whole array of different specialties that we will define together where we understand the needs and we can optimize the curriculum with Michener. So it's my intent to put Brian in this role so that we can bring these issues to the executive table. We can have concrete conversations around the issues related to our educational efforts. And we can continue the incredible work that exists throughout the educational centers that are inside UHN that really represent such an important treasure that we have inside our organization, something that can be leveraged over time to create value for students, for the organization, and for society as a whole. So this is how it distills down into a short summary. What I want to do now is to spend some time talking about some additional roles that I think are really critical to our ability to execute. And there are three that I want to highlight. First of all, a sharpened focus on patient experience, an increased lens and concentration around issues of compliance and regulation with the myriad of regulations that we are held accountable to, and our need to sharpen our talents around business development. Let's talk about the patient experience. This is a quote that I often come back to from Maya Angelou, and it really illustrates the point that what we say and what we do oftentimes don't matter to patients. It's how we make them feel. And that is so core to what we're here to do. When you look at the impact that we have across the organization and the ability that we have to be leaders in defining what does it mean to have an optimal patient experience. Here's an example of what I'm talking about. This is a letter, de-identified, but that helps us to understand the impact that we have on patients. If you take a look at this, and I don't know if this projects to the back of the room, but I'll read it for you. My husband and I would like to express our heartfelt thanks to all the management and staff for the saving of the life of my mother. If it were not for the skill and dedication of the doctors, nurses, and support staff, we are convinced that my mother would not have survived her recent health crisis. After surviving an 8-hour surgery, which included a repair to her aorta, you'll be pleased to hear that she's now recovering well and can now walk with the assistance of a walker. We expect she will be able to return to her home this Friday. We were impressed by the medical excellence, compassion, and professionalism exhibited by staff and how they dealt with my mother's unexpressed needs and desires, which could only be surmised by the written expression of family members, because she was unconscious for over a week. The entire team has earned our respect, admiration, and gratitude. When we look at these words, this really is a concrete example of what we're trying to achieve. We want every patient and family to have that experience here at UHN. We will put Joy into a position as Patient Experience Officer and Chief of Health Professions. This will build on the great work that Joy has led, working together with you around our Partners in Care strategy. Partners in Care was one of the things that impressed me the most when I came to UHN, when I saw that I didn't have that much work to do around patient experience. There was already a lot of great work being done. And when we look at this in the context of the Ministry of Health's priorities, we can see that this is completely aligned with their focus around the patient experience. And that this positions us to be leaders in the patient experience. I want us to be the leading organization in Canada for the patient experience. I want other organizations to come to us to say, how did you do it? Please teach us. And that's what we can do by building on the kinds of experiences that I've illustrated. So what we will do is position under Joy elements that are critical to the patient experience, the bioethical principles that we use when we think about how to talk with patients, the interpretation and translation services that are critical in a city where half the people were born in another country. the nursing and health professions who make up a substantial proportion of the patient experience. As a physician, I remember making rounds, and I might be in the room for 5 minutes. And the other 11 hours and 55 minutes were other health professionals who were defining that patient's experience. We want to position and excel in patient and family education. We've got to reach out to patients in different ways. We've got to expand our patient portal. We've got to position ourselves as available on handheld devices and tablets. We can do this through the incredible work that has already been accomplished here through Sharon Rogers. Everyone in the room knows the great value that Sharon has created. Everyone knows how she speaks up around the patient voice, how she brings a rational perspective to the table, how she can silence physicians at times with common sense. And we are so grateful to Sharon for bringing that focus and now being able to team up with Joy and a big team that will really help us to move the patient experience forward. I want us to be known for an outstanding patient experience. I want to say a few words about business affairs. Of course, how we operate our business is very important. And as I came into the organization and started to look at it, I saw some gaps that need closure. So this will really create an opportunity for 2 additional positions, for external business development and for compliance. And I'll walk you through each one of these positions. We certainly have a need to enhance our business development. When we look at what we bring to a relationship with a company or another country, we really need to begin to think differently about how we approach those relationships. In my last job, I did a lot of business development. I did that by partnering. I was the physician. I was bringing medical subject matter expertise, content knowledge about oncology care delivery. I was partnered up on airplanes, visiting health systems in other countries, and we were talking about how to do a deal together. And I was bringing my content expertise with 10% insight in business development and very modest, underdeveloped business development skills. And I was pairing that up with another individual who had advanced negotiating skills and understanding of intellectual property management and negotiating. And that's something that we really need to bring to the table so we can partner that individual up. I see that as somebody that will come from outside the organization. And the board also believes that this is somebody that they will help us to identify and recruit. And we can bring somebody in who's got tremendous personal and professional experience, who wants to join our great team, who embraces the mission that we share, and wants to contribute and bring these kinds of skills to the organization. Compliance is another area that we need to sharpen our focus. We see in the media recently many examples around conflict of interest and compliance matters. And as I saw the organization, I saw compliance issues sprinkled in different parts of the organization. We have a need to bring that together under one accountable individual who we all know is the Chief Compliance Officer. That person will report to Justine and will ensure that as it relates to issues such as conflict of interest, enterprise risk, privacy, and regulatory and compliance matters, one group or one office is going to be accountable to make sure that we stay within the lines, that we're operating the way we should be, that we're a state-of-the-art organization, and that we don't let things fall through the cracks. So when we pull this together and we add in the foundations and the other parts of the organization that are important, what we see here is the external business development and foundations on the left side of this graphic, which really represent external sources of revenue that help us to achieve our mission. And on the right side, Fatima Sharif, who's been a great asset to the presidential office in helping us, the executive team and the senior management team, move issues forward. Jillian will continue to serve outstandingly in the role that she's had in communications and public affairs. Now I want to talk a little bit about some of the key organizational shifts that will be important in terms of how we organize ourselves and how we operate. These are two of the key points that I think represent some takeaway messages from today's conversation. That we have a reconfigured executive team that's aligned with the 7 areas that we've been talking about. We have agreed upon concepts and principles that we've got to have excellence in these 7 areas. And then we are focusing on another principle that we could collectively describe as hospital-specific accountability. Let me explain what I mean by that. What we're really talking about are building, strengthening the leadership teams in each one of our hospitals, and doing so in a way that we create responsibility, accountability, and oversight, where we position those leadership teams as wholly accountable for the outcomes in that hospital. That's not what we have at the moment, but that is something that we're going to move towards. This will enable much more streamlined and efficient decision making, and it will enable us to achieve what we've been talking about from the very beginning: working smarter, operating safer, and making our work lives simpler. Let me illustrate what I'm talking about. This is an example of what I found when I arrived here, and I was trying to understand how do we operate. And what I saw was an unusual situation that has worked well for UHN, but may not enable us to work optimally for the future, where we had hospital executive overseeing hospital A who had operational responsibilities in hospitals B, C, and sometimes D. And when that happens, then sometimes individuals are in meetings off-site, directors are on a shuttle bus, and attention is directed to another facility. We want to make the distinction between operational oversight and non-operational oversight. We want all of our directors, all of our leaders to have the opportunity to contribute to the organization at a higher level. And when we think about that, we want that to be in non-operational areas. So when we have an organizational initiative like Lean, like hospital-acquired conditions, or extension of the safety survey and culture, we want that to be enterprise-wide. We want those executives to be able to contribute, to grow as individuals, and to be seen as team players for the entire organization. But when we are talking about hospital operations, we want that focus, that leadership team to be directed inward. We want that group to be wholly accountable for all the outcomes. So what we're talking about is something that looks closer to this. And this is what you would find in other health systems of our size, or even smaller, with a smaller number of hospitals, or health systems that have 12 hospitals, where you have one chief operating officer and you have site-specific, hospital-specific accountability for outcomes. If we were a management team, we would be talking specifically about key performance indicators. We would be talking about, let's agree, what are the KPIs that we are going to use to evaluate operational efficiency. Let's have one team accountable for those outcomes. Let's make one team responsible for the safety culture. Let's make one team responsible for employee engagement. And when we do that, I think we're going to operate more effectively, more efficiently. We'll get better outcomes, and very importantly, we'll be ready to grow. Because when the next integration opportunity shows up on the horizon, we want to be ready for that. The configuration that we have right now is not optimized for us to grow. And part of our obligation is to work together to create a system that operates efficiently, effectively, and enables future growth. So let's pull this all together now. Now, this is not going to project to the back of the room, but we will post it online. And it really shows how we've realigned organizational subunits. What I want is for all of you to be able to look at the message that I will send out later today, look at the links that we will post over time, and enable everybody to do what I really want. I want all of you to know how I fit and why I matter. And I think that all of us know that we're here together, that organizations exist to allow us to create, to discover, to innovate. And by coming together in this way, we can sharpen our focus and move our mission forward together. So this will be the new executive team. I also want to point out that there are other areas that require further study, other areas that require more conversations, additional external input. And some of those areas I've listed here. Let me just walk through those with you. First of all, quality and safety. It's amazing that I've gotten through this many minutes and I haven't talked about safety. But it is an important focus that we will build over time as we transition to a high reliability organization. And as we do that, we're in the midst now of a process that involves a steering committee looking at a whole host of conditions, narrowing a group of hospital-acquired conditions, thinking about a target that we will have for harm reduction, thinking about a timeline that we will agree upon together. And we want that work to proceed. And as that work proceeds, and as it does through collaboration with our hospital partners, with Sick Kids, with the Sinai Health System and Women's College, we want to let that process evolve. And then at the end of that, we want to look at what kind of structure and resource allocation do we need to match up with that plan. So we will come back to how we organize ourselves around quality and safety when that work is done. We have a need to really sharpen our abilities to operate effectively around information technology. Two important things are underway at the moment. Many people here are aware that we have Deloitte, an external consulting firm, coming in, looking at our IT across the entire organization. And this is enabling us to benchmark where we sit right now against other organizations of similar size, similar mission, similar number of employees, similar budget. And we want to see where we stack up in that group. We want to look closely at how IT is organized inside our enterprise. And are we positioned to move ourselves in the direction we want towards bioinformatics, intersectoral collaborations, and some of the things that we've been talking about today, or do we need to make changes? That will be informed through the external review and through David and Lydia working together as David begins to meet with people, talk with the SIMS team, visit with teammates around the organization, and think carefully about how we need to move IT forward. So it's a combination of David's input and the external review that will really help to inform how we really think about IT. It's important to me that we have some key advisory groups in place. I can't serve all of you without good advice. I really need your input. I'm so grateful for the emails that I get from so many of you, believe it or not. I do my best to answer those, but I read them all. And these help me to understand the organization in ways that I cannot any other way. When we get together with small groups, I learn from that process. I synthesize that learning and I integrate that with other ideas that come to me. I want to ensure that I position myself with the right kind of advice from throughout the organization, and that I recognize that in order to serve you optimally, I cannot do that without good advice. So I want to really think carefully about the optimal advisory systems that we should put in place to help inform decision making and to ensure that the right stakeholders are brought to the table when we think through issues. We also want to think carefully about our support systems. We've talked already about IT, but when we think about other support systems that are key for us, for example, finance, or human resources, or business analytics, do we have those optimized today? That's something I really want to come back to, spend a lot of time looking at, and benchmark ourselves against. We want to make sure that we are primed and ready to operate with the most sophisticated business analytics, because we're not going to be able to compete in the future world unless we're informed about our business. The last point that we will study closely is our international efforts. Many of you know that we've had broad impact around the globe through publications and through the programs that we have that have extended our reach to the Middle East, to China, and to other places around the globe. We want to think carefully about that international business. Does that represent a future opportunity for us, or does that represent a distraction? And that's something that we want to think through very carefully. As we look at the healthcare system that we have here in Ontario, it's a world-class system. But if you look closely, we've put walls around it. And we don't see that we could, conceptually, turn this into an enterprise. We could become a destination center for healthcare services. We're not set up to do that right now. We, UHN, have good experience and can demonstrate that this can be done without disadvantaging Ontarians. So we want to think carefully as the government thinks this issue through, and we want to position ourselves optimally. We want to think about the international work that we do, both the outbound consulting work that we do, the facilitating work, the deals that we've done in the Middle East, and we want to think about, should that work be extended? Does that represent a real opportunity for us to really go global? I want to think that through carefully with all of you, and I see that as something that's going to require a lot more thought, a lot more discussion, and something that we will need to come back to over time. So where do we go from here? I'd like this renewal to begin over a 4-week period, starting around October the 1st, recognizing that we don't want to carve dates in stone. We don't want to precipitate 25 meetings in 10 days. We want to think thoughtfully about how we do this. We want to bring the kind of insight and perspective that we, UHN, always do. We want to make sure that we don't rush to the finish line without thinking carefully. Measure twice, cut once. Think carefully about how we reorganize and realize that this will be an adaptive learning process. I really expect all the leadership teams to work together, to look at the new areas we've created, to find ways to adjust over time using the principles of a learning health organization, using concepts of an adaptive learning process where we look to work together better and where we realize that what we put into place today will not necessarily be the way we look 6 months from now. We know that additional resource allocation will be required, and I commit to allocate the right resources to ensure that we do not create situations where we prime people in a situation where they cannot succeed. I also want to commit to come back to all of you at regular intervals. Too many things are happening for us not to be having these kind of conversations on a regular basis. So I do not view this as a one and done type situation. I view this as a beginning of an organizational renewal, of an opportunity for me, the executive team, the senior management team to be communicating with all of you on a regular basis about key issues that are going on in our organization. This is an important message as we think about lessons that Charles Darwin learned a long time ago. And we realize that in order to survive, we need to adapt. We need to change. And it's only the organizations and the institutions that are able to do that that will survive over time. At the AGM, I closed with these comments, and I really would like to emphasize how important this is. We aren't here just to operate the organization. We're here to advance it. And we want to be working together. We want to be famous for the work that we will do, not work done. Work done is history. That's great, but let's move into the future. We need to think about where we want to be 10 years from now, 15 years from now, and chart a path from here to there. So I really see this as a process of organizational renewal, where we will come together and we will begin what will be a magnificent journey together. I'll stop there and create an opportunity for us to have some questions. Michael will facilitate this in a moment. I just want to perhaps offer one final reflection, and that is that when we think about institutions, why do we have them? They're really an interesting social matrix that has been designed to ensure that our ideas, our creativity, and our good deeds continue in perpetuity. And I think that that's why we exist as an institution, as an organization. Institutions are created to enable groups and individuals to grasp the reality that as human beings, we're only here for a fixed period of time. And our shared aspirations can be realized through the work of institutions. And that's really what brings us together tightly around a mission. And that's how we're going to move the organization forward in the years to come. So Michael, maybe you want to facilitate some questions. If you have...